everybody. This is Dr. Michael Hirsch, right back at you at the Senior Center. This is catching up with our Senior Center people, and hopefully, if you watch this, you may not be watching this remotely anymore because the Senior Center reopened, and maybe you'll be sitting around a TV set watching this together with your friends that you haven't seen in a while, because we have actually reopened quite a bit in the last month since I talked to you. Last month we were in the middle of a very, very bad surge. The Omicron variant of the COVID virus was just spectacular in how many people it infected. Whether you were vaccinated or not made a big difference as to whether or not you got sick. And if you had a booster on top of your vaccinations, you stayed out of the hospital, and it felt like maybe getting a little mild cold at the worst. And many people just found out they had it by testing. They didn't even feel that bad. So as fast as the Omicron surge came in mid-December and peaked around January 10th, it suddenly just has plummeted. And we've been watching at the Department of Public Health, almost undetectable virus now in the wastewater that we're testing in the Blackstone Valley. We have very low positivity rates as far as the number of people that get tested. Is only about a 5% positivity rate. It had been as high in January as 25%. We're also seeing the hospitalization numbers going way down. ICU numbers, unfortunately, and the death numbers always lag behind these numbers that I told you that were good. So those numbers are still not as great as we'd like. 513 people in the city of Worcester have died since the beginning of the pandemic, which is roughly going to be in the middle of this month of March where we're recording this. March has lots of different names that people call it. It's the March that comes in like a lion and goes out like a lamb. And then at the end of March, you should be seeing signs of spring. The Ides of March was March 15th when Julius Caesar was assassinated. There's lots of warning things about March. And I think that we're in a very precarious but good position. Precarious, I mean, is that it's up to the Department of Public Health, where I work as the medical director, to really be watching to make sure that as we back off on a lot of the restrictions that we've had, that we don't see an uptick again. And if we see it, that we catch it soon enough that we can reverse the bad trend. But right now the trend is good. So last month, our Board of Health was able to agree with us to rescind the mask mandate. As of the 18th of February, that was rescinded. And we're waiting to hear about their decision on March the 7th about school kids and their mask mandate. We are following the Department of Education, Secondary and Elementary guidelines, DC, we call it. They recommended that the mask mandate be over on the 28th of February, but our Board of Health wanted to see what week or two of results from transmission and case numbers from the time when the kids came back from their school week vacation, which started on the 21st of February and will end on the 26th. So we're just plowing through lots and lots of data at the Department of Public Health. Our epidemiologists are working really hard. And I consult every week with a panel of infectious disease and virology experts that so far are telling us only good things, which is great. However, there are some warning things that we have to talk about, right? The mask mandate said you don't have to wear your mask anymore in indoor spaces. But it didn't say you shouldn't wear your mask if you were feeling much more comfortable wearing it if you were over 75, if you have immune compromise issues, these are reasons to wear your mask. If you live or you work with people that have those conditions, advanced age of over 75 or immunocompromised, then you should wear your mask too out of respect for them. If you're unvaccinated, you should still wear your mask because not only can you get sick, and 97 times more likely will you be admitted to the hospital than a vaccinated person if you get Omicron. If you're unvaccinated, you should wear your mask. Now, unfortunately, the unvaccinated don't believe in the vaccine for whatever reason. They probably don't believe in the mask either, which is why we're still vulnerable to attack from variants. So Omicron was a variant of Delta, and Delta was a variant from Alpha, and that's how the COVID kind of family tree has gone. And now there is a new variant called Omicron BA.2, which is starting to appear on these shores. It started in Denmark in Europe, made its way to England, and now it's here. And just like all the other COVID varieties, COVID doesn't respect boundaries. It doesn't care what distances are between your borders. It's going to get here eventually. So we're watching very carefully to see whether that BA.2 variant starts to pick up the way that Omicron 1 did. The first week of December was the first time anyone saw Omicron 1 on our shores. By the next week, second week of December, we started seeing a smattering of cases here. By the end of December, it was 95% of all the cases, and it kept going up exponentially until it hit its peak around January 10th or 11th, and then started to plummet. So we have to watch this, and we have to be careful that if you are a high-risk person, or you live or work with a high-risk person, keep wearing your mask. If you feel like wearing your mask just because you're uncomfortable, you're going into an indoor situation, a shopping mall or a grocery store or a restaurant, you should feel free to wear your mask. And we've asked all the citizens of Worcester to be tolerant, be a mask-friendly community, a community where no one's going to come over to you and say, hey, why are you wearing your mask? It's nobody's business but your own. If you choose to wear a mask, go for it. If you don't choose to wear a mask, it better be because you've gotten all your shots and your boosters. If you're unvaccinated and you're not wearing your mask and you're not getting the vaccine, shame on you because you are one of our problem people. You're one of the folks that are helping these variants to keep popping up. So right now, I wouldn't say I was the most popular person in Worcester because half of the people wanted the masks to stay on longer until we saw whether this new variant, the BA.2, was here or not. And the other half felt I should have taken the masks off much earlier. So I'm not getting a lot of fans this way. But you, the seniors, have been really kind to me. You've been listening, you've been doing your distancing, you've been washing your hands, you've been making sure that you are wearing your mask whenever you're in contact with people that either you don't know, outside of your bubble, as we call it. So I'm very, very proud for you guys. And it's very important that you continue to be vigilant because still 75% of the COVID deaths have been in the age group over 70. So we've got to protect our elders. Our seniors know how to protect themselves, and they can give good advice to their families. But now that the mitigations are coming off, you're very much dependent on kind of the honor system of who else is out there. Unvaccinated people that are walking around without a mask are a problem. And hopefully, if you feel like wearing your mask when you're going up to the senior center, when you're going into a Stop and Shop or wherever you shop, Price Choppers, feel free to do that, and don't worry about people hassling you. And if you do get hassled, you should let the Department of Public Health know, because we're asking all the citizens to be tolerant of masks. Individual businesses can decide that they want the masks to stay on, because a lot of the business folks have told us when the masks weren't being worn consistently, they were losing a lot of their staff, a lot of their employees to COVID. So to protect their staff, they're asking, can everyone that wants to wear a mask continue to wear a mask? That's perfectly fine. An individual establishment can keep their wear your mask sign, please. And as far as other things that we don't have jurisdiction over, the WRTA buses, if you take that for transportation, if you're going on a plane trip out of Worcester Airport or Logan, if you're going to a hospital, all of these places are required by federal law to continue to have a mask mandate. So we don't control that, and it's an important piece of safety to make sure that their public conveyances do not become a super spreader kind of vehicle. And where else are we seeing nice changes? Well, one of the things that we're seeing is that slowly the vaccination rate in the city, especially after Omicron hit so many people, it went up. We're at about 62% total vaccination now. We're about 44% boosted. And the big holes in the people that are not getting vaccinated are in the age group between 5 and 30. Those age groups have the lowest vaccination rates of all. A lot of parents are not getting their kids vaccinated, unfortunately. Only 30% of our eligible school-age kids are vaccinated. And we want to see those numbers go up. We had a big campaign during school vacation week to help school kids get boosted if they already got their vaccination 2 months ago, and also to get their first shots if they hadn't gotten it yet. And I'm hoping that that number is going to continue to rise. We're behind the state. The state is about 10 clicks ahead of us. About 70% of the state is fully vaccinated. And the county of Worcester is also about 6 or 8 points ahead of us. So the townships around Worcester have a better vaccination rate than Worcester itself. But we're getting there, and we're still trying very hard. Our Vaccine Corps and Dr. Castile's Vaccine Equity Program have been really diligent about trying to get out to the underserved minority communities and to try to get those needles in arms. That's the way forward. And while we're sitting here, scientists in labs all over the country are working on developing a new kind of booster to COVID that will look at the most likely kind of COVID version that we need to protect against, and potentially even combine that vaccine with a flu vaccine. So that would be, I think, my ideal, where you would go in, get your combination flu and COVID shot once a year, and boom, you'll be set for the year. And I think that it's going to be studied very carefully. But so far, what we have been seeing is that antibody levels was the way we thought we had to kind of gauge whether you were protected against COVID. But the vaccine that we give you is giving your immune system a memory about COVID, so that even if you don't have active antibodies already in your bloodstream, when you get touched by COVID, very, very quickly your body has the memory to attack that COVID virus, and very soon you've got all the immunity again. So I think that the thought initially was that maybe boosters were going to be needed in 4 months after the the first booster because the antibody levels are going down. Now we're not really that concerned that the antibody levels are the measure of immunity. There's two types of immunity. There's what they call humoral immunity, which means antibodies floating through your bloodstream all the time looking for the COVID virus. But there's also a thing called cellular immunity, and that's where the vaccine has taught certain killer cells, they're called T cells, to attack the virus. And so long as your T cells have been given exposure through the vaccine to the DNA, RNA material inside the virus, they'll be able to rev up a response, even if the antibody levels are low. So that's why we're pretty optimistic that we're just going to be going for like maybe once a year shots to give us a boost, very much like we do with the flu. And that's how I think things are going to go now. I think we're going to see a period where gradually the case numbers continue to go down. We're going to start taking off the mask, and we're going to be very, very wary, but I think we're going to see that we're not going to get a big surge right now. The warmer weather is coming, and we're going to see what happens as we get through the spring, summer, and early fall. Now, what happens in early fall? Well, every year, at least before the pandemic, that's when we started to see flu and other kind of viruses, commonly viruses in the nose that are called rhinoviruses, lung viruses called respiratory syncytial virus or RSV, and influenza A and B were the kinds of viruses that we saw every fall going into winter. When we were wearing our masks the last 2 winters, we didn't see as much flu, nearly as much flu, which I think is another area of proof that masks really do work. Now, the Omicron transmissibility factor made the original masks that we were wearing, the cloth masks and the 3-ply surgical mask with the ear loops, ineffective. You needed something stronger. You needed a KN95 or an N95 in order to really protect yourself from Omicron. But I think that we're going to keep these masks handy. We need to not throw them away. And maybe the new normal, and this has been done for years in Asia. If you go to Japan, if you go to Beijing, you'll see people, even before the pandemic, walking around with masks. Masks may be the ticket to keeping us healthier during the winter months. And this is obviously the time that so far COVID has seemed to prefer. It likes the cold. So we're not having any mask burning parties here in Worcester. We're going to keep those masks available. You should be able, through the federal government, to get N95 or KN95 masks through any of the big retail drugstores, Walgreens, Price Choppers, CVS. Each person is entitled to 3 KN95 masks, and don't throw them away. And also, you're entitled through the federal government to get testing kits. Now, testing has been very important. And as we have gone away from some of the testing where you have to stand out in a line and the cold in the Mercantile Center, instead now we have these home kits. They're called antigen tests. And they're very simple to use. There are good instructions in the different types of packs that we get. And if you have cold or flu symptoms, and particularly if you have a fever, you owe it to your colleagues, you owe it to your family to use one of those tests to test yourself to make sure that you don't have COVID. Because if you do, you don't want to go to work, and you don't want to send your kid to school if they have a positive test. And I think the combination of that kind of activity where you're going to be testing yourself when you're symptomatic at home, before you go to work, before you go to school, before you go to the senior center, that will help us keep outbreaks to a minimum. So this is, I think, where we're going to see the light at the end of the tunnel. It's going to be all about recognizing when you're symptomatic, you got to do a test. If you're testing positive, then you stay home for 5 days and you have to wear your mask again for 10 days. If you are worried because you have immune problems or you have other issues like cancer or diabetes, or if you're overweight or you're over 75 and you don't feel like taking your mask off, keep wearing your mask. We got your back. We understand that that's a reason that you want to wear your mask. If you're fully vaccinated, and that includes the booster, and you don't have any of those risk factors, and you don't live with someone with those risk factors, you don't have to wear your mask. And life should get fairly normal for you. And if you're unvaccinated, again, I plead with you, please get your shots, because you are still the risk that we face of new variants having a place to percolate and multiply. And those mutations don't just affect you, they affect everybody. And, you know, sooner or later, one of them may come down the pike that completely avoids the power of our antibodies that the vaccines have given us. And that would be a shame. For a developed country that has such a good supply of vaccinations now, to only be at about 70% vaccination, that's too low. We should be right up there with all the European countries that are getting up into the high 80s as far as their vaccination rate. So the only other thing I will mention is that we are looking at the month of March again, and St. Patrick's Day is coming up. The parade is a go for a live parade. We didn't have one the last 2 years, and the city manager and I have been really blessed to be asked to be the co-grand marshals, and we'll be out there. And I was worried when they first announced that I was going to have this privilege, that somehow the COVID surge would not have obliged us and wouldn't have receded by the time of the parade. But I think on March 13th at noon, we'll be marching proudly down the street, and we're celebrating the essential workers, the folks that helped us keep our stores open to get food, who helped us keep our hospitals open to give care, the folks that took care of the elderly in long-term care facilities, the folks that did incredible work as home health nurses, home health aides. These essential workers kept our country rolling. And it's wonderful that the Hibernian Society of Worcester has chosen them to be really the honorees for this parade. So I would urge you to at least take a look at it on TV, or if it's hopefully a warm day, get out there and you'll see us marching. The city manager and I both got special engraved shillelaghs. I've never been so proud. You probably know I'm not Irish, but I grew up in an Irish neighborhood in New York City. As a matter of fact, my apartment that I grew up in was 2 floors above a wonderful Irish pub called the Donny May. And as I grew older and was hanging out with friends of Irish origin, I went down there, and I have to admit, I liked Guinness beer, and I liked corned beef and cabbage. So I guess I'm an honorary Irishman now. And I will quote to you a saying that was on the wall of the Donny May pub when I was growing up. And I think it's a great one for us all to think about, because we've got to use our heads coming out of this pandemic. So it said, "God grant me the hindsight to know where I come from, and the foresight to know where I'm going, and the insight to know when I've gone too far. So I wish you all a wonderful month of March. I'm thrilled that you'll hopefully be watching this back in the wonderful Worcester Senior Center. And we'll keep talking. I'm not going to quit on this just because the pandemic is over. I really love talking to you all, and I appreciate all of the positive feedback that I get from seniors who have watched these little messages. So take care and be safe out there.